having had very little to do with the medical system, all of a sudden I was thrust into it very quickly, and then I found that there was a lot of people who were actually confused by the system. Some of them were getting a bit scared. I thought I should try and help other people if I can, and then I found the Healthcare Consumers Association was actually doing that, and I thought, well, I should dive in and try and help where I can.
A lot of advocacy arises because people have a personal need. So they will have a chronic condition themselves, or they have a child with a disability.
2 incidents occurred with some elderly people who were family friends, so that sort of stirred me up a bit. I thought, well, I'm aware of Healthcare Consumers, they seem to do a good job, so I went along and to the training. The training was good and the organisation was really friendly, so I went from there.
So I'd had a pretty good run in with the health, not a bad experience, but I'd been through the health system and I could see where things could really be improved.
I had to go and look after my dad who was dying from cancer, stomach cancer. And every day when I was at the hospital with Dad or at health services, I saw the adverse events happening. And it radicalised me, really. I mean, I just thought I have to get in there and start bringing about changes. So I joined Healthcare Consumers immediately after that and started my journey.
Well, I migrated to Australia about 20 odd years back. Obviously, I had no idea about the system. The system back in India is totally different. So one day when I read in the local paper your little news item notice which said that you're having a training session for consumers, two Saturdays, and just took the opportunity to join up.
Bit of a long story, really. It started with becoming a mental health consumer. I applied for work with the Mental Health Consumer Network. I not only became a board member, but also I did the training for consumer representation. From then on, I was able to use all my skills and training as a consumer representative.
Over the last couple of years, I've become increasingly involved in consumer representation. I had an interest in ensuring there was more patient information available for people with a particular condition, and it was really just a bit of a journey, one thing leading to another.